My name's John Jones. I'm a consultant in emergency medicine and I'm the clinical lead of the West Yorkshire Major Trauma Network. In 2013, the West Yorkshire Network went live with the Leeds Major Trauma Centre very much at its heart. What this means is that if you suffer serious injury anywhere within West Yorkshire, and for certain patient groups into East Yorkshire, North Yorkshire and some areas of South Yorkshire, you'll be brought directly to Leeds. When you arrive here, you'll be received 24/7 by a consultant-led multi-specialty trauma team. Now, this model has enabled us to centralise our expertise and centralise our resources to improve the care we provide for major trauma patients. Along with all major trauma centres, we submit data to TARN, the National Trauma Audit Research Network. TARN give us data on outcomes and on performance and on the numbers of patients we see. We know from this data that we are one of the busiest major trauma centres in the country. We also know that our outcome, when it's adjusted for the type of cases we're seeing and for patients' comorbidity, is amongst the best in the country. The figures estimate that we save roughly 1.7 additional patients per 100 that would otherwise die from their injuries. We receive and treat well over 1,000 patients a year with major trauma from across the Yorkshire region. The work that we've done so far has given us a fantastic foundation from which we can continue to improve the care we provide. I don't think it's overly optimistic in any way to aim to make Leeds the best major trauma centre in the country with the best outcomes and the best processes of care for our patients.
Hello, my name is Costa Tingerides and I'm one of the consultant interventional radiologists in the Trust. The CT scanning department is located next door to accident and emergency. Here, two multi-detector CT scanners like the 128 slice scan behind me are capable of scanning the entire body in a matter of seconds. Several such scans take place in trauma patients each day. Severe, life-threatening injuries are recognized immediately and patients have treatment started before they leave the department. Patients with severe, life-threatening injuries with internal bleeding can be treated in the hybrid radiology theatres which are located next to this department. Surgical teams are in attendance and minimally invasive image-guided procedures can take place as well as hybrid radiology and surgical procedures.
The major trauma ward in Leeds is reasonably unique in the UK as we are one of the few major trauma centres that has a major trauma ward. We've been set up since 2013 when Leeds became a major trauma centre. The benefit to the patient is that by being on one ward with a consultant-led ward round every day as part of the multidisciplinary team as well, the patient gets optimum care. One of the roles that was different and was set up and unique to us was the major trauma case manager, and these are like nurse specialists, if you like, for major trauma. So they see the patient right from when they arrive into A&E as part of the trauma team, and then they would coordinate and facilitate where they go next. Also worth noting that we have advanced nurse practitioners on the ward, which we've had since inception, and this is great because we're able to get that kind of senior decision making as part of the consultant-led team. We are a centre for PROMs, which is patient-reported outcome measures. What we do is we see the patient just before they leave hospital and do a questionnaire with them, and they consent further to have a further questionnaire done at 30 days and later on during the year, and this is followed up by an outside agency. And the feedback that we get from that is really, really good. We're committed to giving true holistic care on the major trauma ward. We have support from services such as psychology, SALT, dietitians, as well as we've already mentioned the other specialist nursing staff and allied health professionals. Finally, we have a dedicated charity called Day One, which is a charity set up by Professor Giannudis. It's run by ex-patients who have suffered a significant polytrauma. This is actually going to be rolled out nationally now to other major trauma centres as a result.
A big part of the major trauma work happens in theatres. This is the Jubilee Theatre complex at the LGI. This is one of the major trauma theatres. We have 5 of them with laminar flow, where we can operate in multidisciplinary type of manner. Many specialties can be coordinated and act upon obviously the need of the patient. There are 15 theatres in the Jubilee Theatre complex where they host many of the specialties relevant to the acute trauma. This is orthopedic, surgeons, plastic surgeons, neurosurgeons, spine surgeons, cardiothoracics, vascular surgeons, maxillofacial surgeons. And in this theatre complex, we can accommodate any eventuality of a complex polytrauma scenario. We can operate well coordinated as a team in different areas of the patient. An essential part of the coordination of the flow of the patients in our trauma theatre complex is the so-called bunker room, where we have specialist trained staff that can coordinate the flow of patients, receive all information from the new arrivals at the emergency department. This gives us situational awareness, which is an essential part, and good communication, which is another essential part to the flow and the management of these complex scenarios.
So here in Leeds, the Major Trauma Centre is for children as well as adults. It's around 10% of admissions, around over 100 a year. Here we have everything on one site, including paediatric intensive care, all the paediatric specialists, on top of the fantastic facilities for adults. So we don't have the problem of being isolated, which can happen with other children's hospitals on a separate site.
Hello, my name is Max Troxler and I lead the vascular surgical response to major trauma. In the past, we just used to deal with the traditional vascular injuries, but since the MTC was established, we've extended our role to deal with patients with abdominal and chest injuries. So these are the patients who, through motor vehicle collisions or from falls from height or through assault, have injuries to their liver, their spleen, their intestines, or occasionally have life-threatening bleeding into the chest. Nationally, this role is performed by general surgeons in many centres or by vascular surgeons in a few, and I would say insightful centres. But no matter who is delivering that service, the key thing about developing excellence in this sort of trauma surgery is the timely application of skills from both specialties. As the training in general surgery and vascular surgery separate and become more specialised, a challenge for the future will be how we can equip our trainees with the necessary skills in terms of decision making and operative skills to be able to provide a service within a major trauma centre. Here in Leeds, we're trying to address that problem in several ways. Last year we organised a trauma symposium for the vascular and general surgical trainees within Yorkshire, and that was so successful we aim to try and advertise that nationally in the coming year. We've developed links with the Ministry of Defence, who last year funded a very successful fellowship post, and we hope to be able to repeat that in the near future.
So the BOAST is a set of national standards by which all lower limb trauma is benchmarked. It's an indicator of quality of practice and outcomes for patients. It's going to be a NICE guideline next year, and they're reported on a quarterly basis on a dashboard. So when MTCs opened, our BOAST 4 compliance was 20%, so basically 2 out of 10 people who came to our MTC got standards that were judged to be of national standards, and we were ranked 19th out of 22 MTCs. Since then we've had significant service redesign, and subsequent to this the BOAST 4 rankings have risen dramatically. So in March 2014, a year after our first one when we were ranked 19 out of 22, we got up to 39% and we were ranked 10th. And then in June 2015, which is the most recent quarterly results, we've been ranked at 87%, which is ranked second nationally but first among all our peer trusts. We're actually one of the busiest MTCs for lower limb trauma, and our ranking at the moment is top. We have become a flagship centre basically within 2 years of opening for lower limb trauma. We outperform not only our peer trust but almost every trust in the country. All of us work along the motto of the right operation in the right place at the right time by the right people and right first time.
I think I can speak for my colleagues that although trauma surgery of this kind can be immensely stressful and difficult, the key to looking after these patients is working collaboratively within the MTC. And I have to say that seeing the sickest patient recover is both professionally and personally very rewarding.
The Leeds Way: collaborative, fair, empowered, accountable and patient-centred.